First at 6 o'clock, Tulsa hospitals say their ICU beds are filling up, and the flu is a big reason why. Thanks for joining us. I'm Lori Fulbright.
And I'm Jonathan Cooper. Healthcare workers are also busy with COVID cases and RSV. News on 6's Amy Slanchik has the latest from Tulsa doctors.
Tulsa healthcare workers say we're in for a long winter when it comes to the flu.
We are definitely going to have a worse flu season that we've seen in the last few years.
Dr. Ritu Signh is the chief medical officer at St. Francis, where she says they're also seeing a 40% increase in COVID hospitalizations compared to the previous week's data. She says some patients are fighting COVID and the flu at the same time.
Last few years, we did not see this much of flu because of social isolation and people were masking up, and that is not the case this year. So flu is definitely on the rise.
Hillcrest Healthcare System says lately it's been seeing between 13 and 18 new COVID patients a day. But just today, the system saw 57 new flu patients. And these numbers are having an impact on ICU bed capacity.
Over the last day or two, not just Hillcrest Healthcare System, but probably across Tulsa County and Northeast Oklahoma, we've seen some significant capacity constraints.
Data from Johns Hopkins University shows last week Oklahoma's ICU beds were 83% full, compared to nationwide numbers from last week, which showed ICU beds across the country were 77% full.
What the community can do is just try to, I don't want to use the word isolate, but that's essentially what is going to be needed, is isolate the sick from the non-sick.
Health experts say this is still a good time to get flu and COVID vaccines. They say you can get them at the same time in the same arm, and it takes about 2 weeks to reach full protection. In Tulsa, Amy Slanchik, Oklahoma's own, News on 6.